National Association of Nigerian Nurses and Midwives has called on the federal government to prioritize health workforce financing. It also called for the engagement of over 115,000 graduate nurses eager to contribute their skills and expertise to the nation's healthcare system. The president of the association, Haruna Maman, made the remark at an event to commemorate the International Day of the Midwife and the commencement of the 2025 International Nurses Week. Maman said this year's event with the theme, Our Nurses, Our Future, caring for nurses, strengthening economies, underscored the importance of a healthy nursing workforce. He therefore called for immediate funding and workable solutions to safeguard nurses and midwives from emotional, mental, and physical difficulties. In January, the Katsina State Council of the Association declared the withdrawal of nurses and midwives working in the hospitals located along the front line and vulnerable areas in the state over the abduction of one of the association's members, Nurse Yusuf Mairuwa, by government. Mairuwa was said to have been abducted while on duty at the General Hospital Kankara on January 15, 2025. Nurses urging the federal government to prioritize workforce funding.
I think we're Nigerians. It's not hidden. These people are risking their lives for us, and as they're doing it, ordinarily, if you should check or take statistics from our neighboring countries like Ghana, you will notice that the way they take care of their nurses and midwiferys, it's mouth-warming. Yes, you see that it's watering, it's mouth-watering. Like you will see that to become a nurse, you'll be hungry to become a nurse. But in our own case, like during the COVID-19, I remember that this nurse who died. I know her very, very well. That was from the D-line experience. She died, in cause of trying to protect life, in cause of trying to safeguard someone else's life, and trying to practice and put to practice what her profession. She died in a line of job. Did they remember the family of this person? Have you heard any day they say they want to celebrate her? No. Instead, Nigerians will give escort to somebody who has been deceiving his people in the name of representative. Somebody that has never contributed anything to the country. Somebody that has nothing to offer because he is a politician. Meanwhile, the people who need this safety and funding are these people who are in the health sector. Go to all the public hospitals, Go to the health centers, Go and see the way the nurses are being treated. Go and see if they are guided. Go and see if they see them like people. Go and see if those hospitals are put in place. If they are well, supplied,
Okay.
or if they have every accessories, if they have every requirement, like supporting hand. When you say supporting hand, you know what I mean. No fund. Most times they will hold these nurses for 5 months. Nobody, because they don't have a voice. Who will talk for them? Who will speak for them? They are not NLC now. They are not. Nobody will talk. Nobody will speak for them. Go to that place and see how they are suffering. You will see some persons who have mental health, who are suffering from either psycho-mental impairment or something. You see them there. Those that are in the area of psychiatric, to go and see what is happening. Most times these people break their head. Most times they attack them with weapons. Most times they pour them even hot water. But the nurses will not give up. You still see them, they are working. On your own, make a research and see what their welfare is nothing. Because they don't have a voice. Look at a politician who is just ordinary, in fact, an aide to a local government chairman or something. Check the kind of salary he gets. And check the salary these people who do the real job gets. A politician that is an SSA to one local government chairman, if they tell you the salary they get, you will shout. I'm telling you, a take-home salary. The same thing goes to the state level. The same thing goes to the federal level. And other appointees. And other, what they call them? Other small offices. See what is happening. As to compare with these nurses who are now trying to, I don't know how God touched whoever that is helping them to speak now. Who are now asking Nigerians, who are now asking the federal government and state government and local government to help them in funding all of their activities and beautifying their life with the needs, their social needs. You know that with finance, you can be anything, you can be fine. Finance, I told my friends, I say finance bring happiness. Yes. Once you have money, you are happy. But these people, most times, they don't even get transport to go to work. And most of them, those who are in the area of, what they call them. These people, I call them people, care for the elderly.
Okay.
Have you seen these people where these mothers and fathers who pull on them? They will still not stop. They will make sure that they are okay. They will make sure that they are okay. Have you seen where someone is giving birth before? They kind of shout. The mental effect. Someone wants to give birth, the way they are shouting and yelling. Some of them will even be abusing their husband in the presence of their nurses. But they are shouting, they are talking, they are saying sort of things. I'm asking, these nurses will not sleep at night while we were sleeping. They'll be awake till morning because they want their patients to be fine. Because they want to watch over their patients. And some of them who are wicked because of the way they are treating them, they will not talk to you. They are at work, they are on duty. It is their duty. I mean, they are on duty. They are supposed to attend to you, they will not attend to you. You think they are happy. Let me cite you UPTH. Go to UPTH and see the way they are. Nobody's business, so your health is none of their business. They don't look at you. Because of that, those of them who are doctors, some nurses on their own, because maybe their husbands are rich, on their own, they go as far as building hospital of their own.
Yeah, I was to come to that because don't you think it's more like in the let's say the state-owned hospitals compared to private hospitals that these experiences are more.
Yes, that's the reason why that's where I'm going to. Now, you see why this whole thing is happening? Because government can only set up a place.
Okay.
Ordinarily, as a government, you're supposed to set up a place. Maintenance, whatever would be attaching, whatever you're setting. Whoever that is that contractor, it is also the duty of the person that you are sending money to them to maintain and supervise whatever that is happening there. Now, a nurse would prefer, I'm not talking about doctors now, a nurse would prefer, if the husband is rich or because she has experience, she would prefer her husband to build a hospital of his own, whether he's a medical personnel or not, and employ doctors and nurses who would take up the responsibilities of health and have a manager who manages whatever happens there. And that nurse will always want to refer you secretly, the same way the doctors refer you to their own hospital, their private hospital. If you go to UPTH, instead of that, they have professionals who who federal government has employed.
Okay.
But they will not attend to you or based on that their own section of profession. They will just come, roam about and say, hey, I want to refer you to so hospital, one doctor. They are referring you to their own private hospital. And that is when they will now come and treat you very well. While you are in UPTH, before you be attended to, somebody must have passed that. Yes. Because the processes of wanting to, under emergency, I'm telling you, you go to this place, you climb up, you come down, you go to the other side. My elder brother died, who was our former king, died. When we rushed him, they said we should go to a government hospital. We said we are going to the private hospital. He said, government, we went. While we were in UPTH, we were running. We were about 5 of us, his children and myself. This person will go this way. Before we could gather this whole paper, the man was already gone. He said, they were telling us we can refer. No, at that time, you're supposed to save this life first.
Yeah.
But they still want to refer you. Why are you being employed? Why were you employed? They know you are capable of taking care of this thing. That is why you are being employed. But they will not do it. You don't see them. They don't care. They are seeing you there and they are walking away. Even when you have been admitted last. Some of them will come. They're supposed to come from 8 o'clock to 12 or 2. You will not see them. They will just come. I'm going to somewhere. Where are they going to? They are going to their own hospital. So they will make more money. They feel that this money does not come to them. And allowing people, leaving people lifeless. And before you know it, the people, you see them dying. That is why I am also pleading with the federal government and state government and local government to help them where necessary and fund them, support them, make sure they are being paid well and they are being taken good care of in order for them to also take care of our own health when we are at their place of work.